Hey everyone, welcome back to my channel, where we dive deep into health topics that could save your life. Today, we're talking about deadly sexually transmitted diseases you likely don't know about. We all hear about HIV, syphilis, and gonorrhea, but there are lesser-known infections that can turn fatal if ignored. I'm not here to scare you, just to arm you with facts. Stick around, hit that like button if you're learning something new, and subscribe for more. Let's get into it. STDs aren't just inconvenient. Some kill silently. According to the World Health Organization, over 1 million STIs are acquired daily worldwide. And while most are treatable, a few can lead to severe complications like cancer, organ failure, or death. We'll cover 4 under-the-radar ones: lymphogranuloma venereum, chancroid, hepatitis B, often overlooked as an STD, and human T lymphotropic virus type 1. These spread through unprotected sex, and early symptoms can mimic common issues, delaying diagnosis. First up, LGV, caused by specific strains of Chlamydia trachomatis, the same bacteria behind regular chlamydia, but these invade lymph nodes deeper. It is rare in the US but surging in Europe among men who have sex with men. Symptoms starts with a painless genital sore you might miss, then swollen lymph nodes in the groin that form abscesses, leading to fistulas. Abnormal tunnels between organs. Untreated, it causes chronic inflammation, scarring, and rectal damage, especially in anal infections. Fatalities are rare directly, but complications like sepsis or bowel perforation can kill. CDC reports cases rising since 2003, with genital ulcers as entry points. Prevention: condoms and testing. Treatment: doxycycline antibiotics if caught early. Next, chancroid, caused by Haemophilus ducreyi bacteria. Common in developing countries like parts of Africa and Asia, it's exploding in some US outbreaks. Unlike herpes, it causes painful, pus-filled genital ulcers that bleed easily and smell bad. Why is it deadly? The sores make you vulnerable to HIV transmission. Up to 10x risk if untreated. It leads to tissue destruction, scarring, and secondary infections. In severe cases, it spreads systemically, causing fever, joint pain, and rarely life-threatening bloodstream infections. A 2019 study in The Lancet noted its role in HIV epidemics. It is curable with antibiotics, but many dismiss symptoms as just a bump. Test and treat as soon as possible. Next, hepatitis B. Hepatitis B virus is often forgotten as an STD because it's also bloodborne. But sexual transmission is huge, especially oral, vaginal, or anal sex. Globally, World Health Organization says 296 million chronic carriers, with 1.5 million new infections yearly, many sexually acquired. Acute phase: flu-like symptoms, jaundice, but chronic. It silently destroys the liver, leading to cirrhosis, liver failure, or cancer. 820,000 plus deaths annually. In high-risk groups like unvaccinated adults, sexual exposure accounts for 30 to 50% of cases. Unlike hepatitis A or C, hepatitis B has a vaccine. Antivirals manage chronic cases, but prevention via condoms and vaccination is key. Undiagnosed carriers spread it unknowingly for decades. Finally, human T lymphotropic virus type 1. A retrovirus like HIV, but stealthier. It infects T cells and spreads via sex, breast milk, blood too. It is endemic in Japan, the Caribbean, and some parts of Africa. 5 to 10 million infected worldwide. Most are asymptomatic carriers. The danger: 5% develop aggressive adult T-cell leukemia, a fast-killing blood cancer with less than 20% 5-year survival. Another 1 to 2% get HTLV-1-associated myelopathy, paralyzing the spine. It has no cure, no vaccine. Management is supportive. A 2023 review in Blood Journal highlights sexual transmission risks, especially from men to women. Screening blood donors helps, but routine STD testing misses it. Use barriers and know your partner's history. These diseases thrive in silence. Get tested regularly, especially if sexually active with new partners. Use condoms. Prep for HIV overlap risks. Vaccinate against hepatitis B, and communicate. Early detection saves lives. Many are curable or manageable. Please do well to like, subscribe, and share to spread awareness. Stay safe out there.